Okay, hello everybody. In this video, we are going to learn about the subject of hospital and healthcare management. Under this, we are going to learn about healthcare waste management. So here, the healthcare waste management is a subject which it has two blocks actually, block 1 and block 2. Block 1 contains the 4 units which are listed on the slide. You can see them. Healthcare waste, which is beginning with the introduction and classification. Unit 2 speaks about categorization of healthcare waste and healthcare waste management process. Unit 3 includes regulation related to the healthcare waste. Unit 4 speaks about the risks related to the healthcare waste. Okay, so these are the units we are going to discuss under the block 1. Next, block 2 contains next. The block 2 contains it is the management and handling of healthcare waste. So how we are going to, manage it, and as well as the process of management, we are going to see the stepwise management process. We will see. It is also given a certain units. Unit 5 is generation, segregation, and collection of healthcare waste. How the waste getting generated from the hospital, how we need to segregate them into the categories, and how the collection has to be done by the waste handlers and the managers of the healthcare waste management category. Then transportation, treatment and disposal under the unit 6 we will study. Unit 7 is handling and disposal of radioactive and cytotoxic waste. Unit 8, the last one, after everything is done. Okay, so the generation of the waste till the treatment and disposal, we will see each one separately into different categories. And lastly, documentation, which is also a very, very important step for the management students. Like as we are studying the subject of the hospital and healthcare management, under this, documentation is one of the important element in every aspect of the subject that we will see. Similarly, healthcare waste management also has a documentation, and we need to write down everything related to healthcare waste and common health waste disposal facilities also, how we need to document them and what are the methods, guidelines given by the World Health Organization, how the review of documents also takes place. Everything we're going to see them in detail. So let's start with the first unit, that is introduction and classification of the healthcare waste. Okay, so you all must be having an idea about healthcare waste. The waste that is generated, the name itself is saying that it is a healthcare waste. You know, the waste, the general meaning of waste is that coming out of any used thing. Okay, which the waste actually speaks about that we acted on something. It is the product or a byproduct of the thing that which you already done. Okay, you can see the general people like the people who work with wood, they release certain waste. The people who work with kitchen, they release different kind of waste. Similarly, healthcare waste is the waste that is generated by the healthcare activities, which includes a wide range of materials. Okay, so if you're working in a hospital, you will definitely have an idea about all the things that we're going to discuss in detail. But since we are studying under different subjects, under different headings, we have to put them in the exam properly, so that we will be not only having the knowledge about it, but also when we go to the clinicals, we need to implement accordingly. Right. So coming back to the definition, waste generated by the healthcare activities, which includes a broad range of materials. What are the materials that will be produced from any hospital or any healthcare setup? It includes needles, syringes to soil dressings, body parts, diagnostic samples, blood, chemicals, pharmaceuticals, medical devices, and radioactive materials. So these are the waste which are included as a healthcare waste, which is given by World Health Organization in 2011. So why we are learning this? So why actually the biomedical waste is being separated, or separately we are learning under this is, it is important that being the healthcare providers or healthcare professionals, the management of healthcare waste is very, very important. And if you do not know how a good management is, we will end up giving a poor management. So this poor management of healthcare waste potentially exposes all the people who are at risk. It includes the healthcare workers, it includes the waste handlers, it includes the patients, it also includes the environment, and also includes the animals that are there in the ecological environment. Okay, So that is what it is saying. We will put them potentially at risk if we do not know about the healthcare waste and how we need to manage. And healthcare workers, waste handlers, patients, and communities at large to infection, toxic effects, and injuries and risks polluting the environment. These are the things that we are going to cause at the end an effect to the other people, to the animals, as well as to the environment. So that is the reason it is very, very essential that all the medical waste materials are segregated at the point of generation. It is very, very important. Okay, so if you know or if you have worked any time in the ward, definitely you must be having an idea that, for example, you take an example of a nurse who gave IM injection or intramuscular injection. Okay, she will take different kind of materials. Like she will take a drug which is ampule, okay, a sharp thing. She will also use the syringe and needle. She will use the cotton. She will also use the paper bag, okay, to collect the dust particles or the waste particles that has been produced. Okay, so once she has given the injection and she goes back to the place where she is disposing the materials into different bins, and you definitely have an idea in the hospital that we have different colors. We have red color bin, we have the green color bin, we also have the white color separate bin, and we also have the yellow color bin. Okay, now you observe that nurse who has given an injection, she will be throwing all the syringe, the plastic material, whatever it is there, into the red, and the needle which and the ampule which is broken, considered as sharp, they go into the white bin which contained with the solution, hypochlorite solution. Okay, so in the similar way, the paper bag which is a general waste goes to the green. So what are we doing with the example? What are we observing here? So this is called a segregation at the point of generation. She is producing the waste at the same time. She is discarding them into the different bins by segregating them. Like what is the meaning of segregation? You are collecting the material with a specific category. Okay, so as she's throwing into different category of waste into different bins. That means the segregation. So this is very, very important that all the medical waste and the material which are segregated at the point of generation only, and that will help us to have a appropriate treatment and appropriate disposal safety guidelines which are given by the World Health Organization 2011. So healthcare waste, we have certain definitions. What we have seen in the introduction part, similarly the definitions are given. Healthcare waste is nothing but it's a byproduct of healthcare. Okay, simple example that I've shown you, yes, that I've given you just now, that giving a intramuscular injection. What the nurse is doing, she's caring the patient. Okay, and the waste she's generated, they are the byproducts of that care that she's given to the patient. Okay, they include sharp, they include non-sharp, they include the blood and body parts, and the chemicals, pharmaceuticals, medical devices, and radioactive materials. So if we are the medical people who worked any time with the hospital, in a single day, we will generate all these kinds of waste. Especially imagine you are working in an oncology ward. Okay, you will even release, you will even generate the pharmaceutical waste which are toxins, as well as the radioactive waste which are from the radiation department. Okay, so these are the things that can be categorized unto the definition of the biomedical waste. Next. Okay, we will see certain definitions. Here, under the definitions, biomedical and healthcare waste and biomedical healthcare management, both the definitions we will see. First one is biomedical or healthcare waste. Okay, why are we calling it as biomedical or healthcare waste? It has been given different terminology of different waste, different names to it. We can call it as medical waste, we can call it as biomedical waste, we can call it as clinical waste, we can call it as bio hazardous waste and regulated medical waste, infectious and medical waste, and healthcare waste as well. Okay, so these are the different names have been given. But main importantly, we need to understand the difference between what is biohazardous waste and what is non-hazardous and general waste. Okay, so it is clearly given that anything, the World Health Organization clearly differentiates that anything that has contaminated with the blood and body fluids, which include sharps, human tissues, fluids, and any other material that is been contacted with the blood and body fluids, considered as biohazardous waste. And any non-contaminated waste is considered as non-hazardous waste. That is a basic classification that we all need to know. Okay, coming to the definition which is given by World Health Organization, which we have seen very recently in the previous slide. The same thing, healthcare waste management is a byproduct of healthcare that includes the sharps, non-sharps, blood, body parts, chemicals, pharmaceuticals, medical devices, and radioactive materials. Okay. Next one, medical waste. No, Medical Waste Tracking Act 1988. It has also given a definition that is medical waste is any solid waste that is generated. Uh, yeah, medical waste is any solid waste that is generated in the diagnosis, treatment, immunization of human beings or animals and research. Okay, what is the difference we can observe in the first definition and the second definition? First definition is very general, that it's a byproduct of the healthcare. Okay, and it is given the different classification or different materials that we produce. Whereas in the second definition, we can see what is that healthcare includes. Okay, it includes a diagnosis. What does it mean by diagnosis? In order to diagnose a condition of the patient, we use the labs. Okay, for the lab, for the lab to work on identification of what is a particular disease or diagnosing particular condition, they take the samples from the body. They take blood, they take urine, they take other samples like CS of any kind of fluid from the body. Okay, the diagnosis, the laboratories are working on helping the patient to know what is his condition or what is he going through. They also generate. So they take out of 2 ml of blood, they use only 1 ml. The remaining 1 ml can be discarded. Okay, that is a waste. Treatment. Treatment includes general wards, ICUs, and wherever we are giving a direct treatment to the patient. It includes IM injections, it includes IV injections, it includes TPN, that is total parenteral nutrition. We use the syringes, we use the IV catheters, we use different type of treatments requires different things. Immunization, similarly of that. Not only the human beings, even we can see the veterinary hospitals where they take the immunization to animals, and the medical research centers, the clinical research and medical research centers. All these things, including the testing, biological, like genetical testing centers, which we have. They also use the sample. They take the sample from the mother, they take the sample from the father. They do the karyotyping. Okay, so they take the plasma, they take sometimes the amniotic fluid if the mother is pregnant, and they do all these certain kind of tests. So they also undergo a category of healthcare. They are, end of the day, they are taking care of the people. Okay, due to that healthcare, they are producing or generating some waste. That is considered as biomedical waste. So these are the definitions. There are other definitions also given. You can have a look in the textbook. Next, we'll see. On the whole, all the definitions have given the waste generated from healthcare facilities like physician offices, hospitals, dental practices. The list of things that they have given, anything that is soaked in blood. Okay, anything that is soaked in blood, which includes the gloves, gauze, uh, yeah, any waste that is soaked in the blood, that includes the gloves and gauze and gowns. Next one is anything that is human or animal tissue. Okay, so which are cut during the procedure. You have treated a patient with fibroid, you have treated or cut some nail or the finger, the toe, due to the amputation. Okay, any animal or human tissue, even the butcher houses, the animal butcher houses also releases animal tissue, and cultures of infectious diseases from the laboratory. Okay, then any waste that is in patient rooms with the communicable diseased ones, and discarded vaccines. Okay, so all these are the waste that has been generated from the laboratories, dental practices, research facilities, and veterinary clinics. So this is a basic understanding of biomedical waste till now. Next, we will see the definition of meaning of healthcare waste management or biomedical waste management. Okay, so what is a management? What do you think a management is? Okay, so management is nothing but it's a process of making the objective fulfilled or making the function be done. Okay, so here the healthcare waste management is how are we managing the healthcare waste. So the definition says that it's a simple statement given. It's a process that ensures a proper handling and disposal of healthcare waste in a safe way. Safety is very important. So it's a process. It includes different steps. The process means it includes different steps, and which are ensuring that a proper handling is required, and proper disposal is also required. Okay, you have thrown simply a cotton which is contaminated with the blood into the yellow bin. You have thrown a syringe into the red color bin. Okay, so how do we handle them separately, and how do we manage them separately? So those things are very, very important. So what is happening here? It's a process of ensuring that the proper handling and disposal of healthcare in a safety way. Then other like steps which are included in it. Okay, so as we have seen that the healthcare waste management includes, as we said, it is a process. It includes planning, implementation, and monitoring of activities aimed to prevent the contact, warrant the health care customers, professionals involved, incidents of ecological influences while reducing the production of waste. Three things we can highlight here. Okay, number one, it includes certain where it begins with the planning and implementation. So whatever the management that is planning need to be implemented. Okay, you can take an example of World Health Organization. So it is the one actually initiated the biomedical waste management. It has given the color codes. It has given the biomedical symbol. Everything is done over there. That is a planning, but implementation comes into our hands. Okay, and third important thing is monitoring. There should be always the supervisor. There should be always the meter that we need to check our objectives to. Okay, so planning, implementation, and monitoring is very, very important. What all the activities that are we are doing under the term called management. So what it is includes, there are different steps. We are going to study them under the management. What are we actually supposed to do? But the main intention is the main intention is first to prevent the contact. Okay, why are we actually doing the biomedical waste management? Is to prevent the contact of the person, then warrant the care of customers and professionals which are involved, and finally we should see that the ecological effect also is not happening. We are not harming the animals. We are not even harming the environment. Okay, next one, the importance, biomedical waste management importance. Why is so important? There are some facts given according to the publishing statement, that is a publication which is given by the World Health Organization in February 8th, 2018. They have given some facts. The number one is amount of the waste generated by the healthcare activities. 85% is non-hazardous waste. It is only a general waste. It is not harmful, non-hazardous. Whereas 15% is considered as hazardous. We have seen already anything that is infected with the blood and body fluids, or toxin it contains, or it is radioactive. That category goes into the contaminated one or hazardous one. So that says about only 15% of the waste. Okay, and there is also every year 16 billion injections are being administered worldwide, but not all of them are properly disposed afterwards. So it is very, very important factor. If you are working as a nurse, or if you are working as a doctor, if you are working as a healthcare provider or a laboratory person, that this is the thing that we need to consider. We are using 16 billion injections administered worldwide, but not all of them are disposed properly. So that is under our own control directly. So we need to look into it. And open burning. So we think that open burning and incineration is a treatment for all. You can see even in general roads also, like the GHMC people, they collect all the waste together, and they put some fire over there, and then it causes the incineration and burning over there, and they think that it is all, everything is gone, but it is very, very wrong. So that is the reason studying biomedical waste management is important. What category of the waste can undergo incineration? Which category of the waste need to undergo different kind of treatment? Okay. So what are we doing here? If you are putting an incineration, and if you are putting a fire to all the waste that you are producing, so because of that incineration, because of that fire, the pollution, you are causing an emission of dioxins, purines, and particulate matters into the environment, and causing a pollution, caused disorders to the human beings as well as to the animals. And lastly, we need to see that the measures ensure safe and environmentally sound management of healthcare waste, which can prevent The adverse health and environmental impacts from such waste, including unintended release of chemicals, biological hazards, including drug-resistant microorganisms into the environment that protecting the health of the patients, healthcare workers, and general public. This is very, very important. Okay. Lastly, what we are supposed to do, we need to take the measures to control the waste. Okay, so we need to see that the environmental is so sound in managing the healthcare waste that we are producing. At the same time, we need to see what kind of impact that we are making and what kind of a waste causes which impact in the environment, even into the people. It includes any unintended chemical waste that we are releasing, so that need to be under the control. And at the same time, drug resistant microorganisms, sometimes we also release them. So imagine an example of the Dettol that has been used, Dettol solution that has been used to clean all the blood stained articles, and throwing all that Dettol disinfectant solution into the drainage, general drainage. Okay, so that also contains the microorganisms which are non-resistant. Okay, what are we doing? We are releasing them into the general waste, right? So that is a harmful effect. So we should see that we are protecting even the general public without doing such kind of acts. Okay, so there are other things also. Healthcare waste is risky because of the following features, like presence of contagious waste, genotoxic waste, cytotoxic waste. So handling is also very, very important. If you do not know what kind of a category or which kind of a category that you are handling, even in the process of treatment, that will cause harm to the handlers. Especially, there are some anti-cancerous drugs, okay, which we give in order to reduce the cancer to the patients. They can destroy even a normal cell. The normal cell, they're not only acting on the cancer cell, they're also acting on the normal cell that we handle with. Okay. So what happens if we do not know how to deal with the cytotoxic medication or cytotoxic drugs or cytotoxic waste? Then definitely it is going to harm us. So it is very, very important that according to the guidelines which are given, we need to know what is a biomedical waste management, what is the classification, how we need to individually manage them, right? Okay, so there is some facts which is not there in the slide. I'm just tell you one study which is conducted. In a study that is done in 2000, they say that sharp injuries were estimated to cause about 66,000 of hepatitis B, 16,000 hepatitis C, and 200 to 5,000 HIV. Okay, so these are the infectious healthcare professionals. The portions is about exposure to HCV, HPV, HIV are 39, 37, and 4% respectively, which is not there in the slide. This is there in the textbook. You can have a glance at it. It's a study which is conducted to have an awareness about, why it is important to us. Okay, next one, we have the sources of biomedical waste. So there are, what is the source? From where the waste coming out of, or from where the waste is being generated. There are major sources and there are minor sources as well. Major sources are the ones which has a excessive production of the waste. Okay, they are like government hospitals, private hospitals, nursing homes, dispensaries, primary health care centers. The list is given: medical colleges, research centers, paramedical services, veterinary colleges, animal and research centers, blood banks, mortuaries, autopsy centers, then biotechnology institutions, production units, as well as um, yeah, so these are the ones which are major sources, considered as major sources, because they produce a large quantity of the waste compared to the minor sources. The minor sources including dentists and physician clinics, animal and tissue slaughter houses, blood donation camps, vaccination centers, acupuncture centers and psychiatric clinics, cosmetic piercing, the tattoo centers and all, funeral services, then institutions for disabled persons. So these are the minor sources because they produce only minimal quantity of the waste. So the amount or the quantity of the waste they generate, the sources classification has been divided. Okay, next one we have the objectives of biomedical waste management. So we have studied what is a biomedical or healthcare waste, what are the definitions, and we have also seen what is a biomedical waste management definition and meaning as well. And we have seen the importance also. Then what are the objectives? Okay, so these are the some of the important objectives have been given related to biomedical waste management. It includes, First one, protect the public health and safety. Okay, even as we think about the management, the biomedical waste management, we are not only focusing on the health of us, the healthcare professionals, we are focusing mainly on the public health and the safety of the general public. Second, provide a safe working environment to waste handlers. Okay, we being the medical professionals, like be it a nurse or a doctor or a laboratory person, we are doing the treatment, we are doing what we're supposed to do as a function of our own daily activity, and we are throwing the things into different dustbins. But if you do not throw them properly without a proper segregation, we are not going to affect, because we are not going to collect them from the dust, from the bins again. Okay, it is the waste handlers are the people who are going to collect the waste from the bins. So for the safety of them also, it is very important that we need to see that the segregation happens properly, as well as the collection also happens properly, so that we can protect the people who are handling the waste. Then minimize the environmental impact of waste generation, treatment, and disposal. So it is very, very important that not only we focusing on our health, not only focusing on the general public and the waste handlers, the environmental impact. We have seen an example of incineration. So we think that incineration is a treatment for all. Like we throw everything and dump everything and put a fire, then it is gone. No, that releases a lot of toxins into the environment. So we need to see that which kind of a material undergo incineration and which doesn't. Then collect and receive the biomedical waste from healthcare facilities. So it is very, very important. One of the objective of biomedical waste management begins with the first step of collection. Okay, the biomedical waste management center or the people who are working under the biomedical waste management need to collect them and receive them, the biomedical waste, from the healthcare facilities, which are hospitals and clinics. Analyze and decide the treatment and disposal the schemes of waste as per the guidelines of Ministry of Environment on the Forest. Not only the World Health Organization, there is a Ministry of Environment and the Forest. Okay, that also helps in analyzing and deciding what kind of a treatment is supposed to be done to which category of the waste. Okay, so according to the guidelines which are framed and revised, they need to follow, the people who are working under biomedical, and which is an important objective. Lastly, describe the concept of biomedical waste management and explain the steps of biomedical waste management, and segregate and dispose waste material appropriately. So we need to learn, not only we are learning, but we need to describe them, uh, the different categories, and explain the steps. Then we should ensure that properly the steps are being followed by all the waste handlers and people who are working under the biomedical waste management thing. Okay, so you can description and concept explanation part, you can see an example of hospital posters. Any hospital you go, in the wards, the paste, the poster, like what color bins contains which kind of waste and how they need to undergo the treatment. Okay, so these are the objectives given by the Ministry of Health and Ministry of Environment and the Forest. Next, coming to the important one, types of biomedical waste. Okay, as we have seen, the basic two classifications of biohazardous waste and non-hazardous waste. This is a classification in detail given according to the type of waste that we are producing from the hospital. First category is infectious waste. So as you can see in the slide, infectious waste is the waste contaminated with blood and other bodily fluids. The infection itself is saying that it is having a microorganism and it is contaminated, and it can clearly cause infection to the other person. It is infectious. Okay,